And welcome back to the morning show, ladies and gentlemen. I'm back down here at Mohave Skin and Cancer. Now, you'd think I'm here a lot, and I am actually here a lot, at least every 6 months, checking on myself for the naughty things that I did by not protecting my skin early on. We got Dr. Bellew today. How are you?
Hey, Bruce, how are you?
Good to see you.
Good to see you.
We were just chatting beforehand. He was telling me what he wanted to talk about, and I said, well, look, what can we do about this? And I showed him on the back of my hand, and you want to pull in on that, please? What is this called again, doctor?
So
these little brown spots?
These lesions are probably one of the most common lesions I see in most people, and they're called seborrheic keratoses. They're actually benign skin growths. They're not dangerous. They're not cancers. They're basically darker brown to almost flesh-colored bumps, and they are very common on the back, but you can actually get them anywhere in the body: the face, scalp, arms, and legs. And a lot of people just don't like the appearance of them, so they want to have them removed. And I'll even have some patients come in thinking they're melanomas because they're dark. And, you know, we're trained to think that a dark changing spot would be potentially a melanoma or something dangerous, and this is kind of the exception to the rule. It's actually not a mole per se. Moles have the chance of turning into skin cancer later, such as melanoma. These have a totally different makeup for the cellular structure, so it's actually completely harmless.
But what I thought of them was old man spots.
Well, we don't like to use that term.
But it's true. Well, I'm an old man, and I mean, these are the spots that
I will say that probably 95% of the people that I see over the age of 50 have these. And the amount that people get is kind of imprinted into your DNA, which is given to you by your parents. So
thanks,
it's a genetic type thing. So you know, everyone's going to get these. They're never dangerous, but they're usually a nuisance. They get itchy. For a lot of people, if they come up on your back, they'll become kind of irritating, and in those cases, we usually remove them.
And they're less than attractive.
Well, it depends. It's kind of like a character spot, I would say. I mean, you kind of know who you are based on...
I have way too many character spots here, doctor.
So, I mean, to remove them, they're actually fairly simple.
Right.
What we would do is we'd bring you into the office, and we could use a liquid nitrogen, which is a cold spray, to basically essentially remove these. And this is the same treatment that we would do for warts, and some pre-cancers that people get on their skin.
You're doing with me all
Correct.
the time,
yes.
Yeah. So what I'm going to do is I'm going to come back in a week, and I'm going to have them do that to this hand, and we've got a couple of them over here, nothing like here, but we're going to get rid of some of these too, and see if we can't bring my... Look at that.
Yeah, they're quite common on sun-exposed areas, so the hands are a common area to get them. The face, some people can get them on their face, and in those cases, they don't like the looks of these, so we remove them in those cases. In general, I've seen some people with 100 of these things on their skin, and so in those cases, we usually tell them, well, we'll treat the ones that you want to have treated, but it's usually impossible to get rid of all of them.
Okay.
And they do come back, but again, they don't have a malignant opportunity to change into cancer. They're just perfectly normal, benign spots.
And the freezing of them, you can feel it. It's a little bit of a sting initially, and then after that, it turns into a little bit of a blister. And if you just leave things alone, it will all go away in less than a week, and you've got a nice, generally less than a week, and all of a sudden you've got some great skin back there again without all this weird stuff. Whew. I'm glad you told me that, because I was really concerned about it. I really was.
Yeah, a lot of our patients come in and see us based on these spots, and even a lot of primary care physicians will bring patients in thinking that they may be potentially melanomas. But because we see so many of these things, it's really an instantaneous thing where we see it and we know it's harmless.
How many times do people come in here and say, Doc, I got this right here in my arm, and you say, okay, let me check you over.
Yeah.
And you find some really amazing things.
That's actually that's the best way to do this, because a lot of people can't see their backs, or they can't see certain areas behind their legs, and or even their scalp. And so I've had patients come in from either a primary care doctor or even a hairdresser who's found a spot on the scalp or somewhere where we normally don't see on a regular basis, and it turns out to be something significant or not. The biggest thing is anytime someone comes in to me just for one spot, I always give them the option for a full body exam, because you know, the opportunity to see the skin, especially in those areas where you can't monitor, we often will find things like that. I've done several skin cancer screenings in Lake Havasu and here in Bullhead, and we've done it for the community, and we've actually found spots that people did not even know they had for years on their backs or on their scalp, and they end up turning to be a skin cancer. And most of these were basal cell carcinomas or squamous cells, which are not quite in the category of a melanoma in terms of the danger, because those type of skin cancers are not time sensitive. Melanomas, you need to catch them early. If you don't, there's a potential for spread, whereas basal and squamous cell carcinomas have a very low likelihood of malignant spread to the rest of the body. But anybody that comes in for a spot, I always give them the option for that full exam. And regardless of age, I see babies all the way up to elderly patients, and I've seen skin cancer in a wide range. I've seen a melanoma in a 17 and 18-year-old patient. So it affects young people. So it's something that's, I think, very important regardless of age to get checked.
So, and it makes a lot of sense. I mean, especially with kids out in the sun as much as they are anymore.
Definitely.
Young people, I don't think they're any smarter than I was when I was a kid. I mean, you hear about this, and thank God most women do use skin.
I wish. Actually, that's not the case.
Oh, no.
The studies are now showing that the fastest growing rate for malignant melanoma in this country is in young females, so 15 to 29 years old. It's kind of interesting, and we think it's because of the sun tanning practices. We think it's because of our culture, and that everyone wants to be darker because they see on TV the celebrities that have the tans and they have darker skin. And they want that.
Right.
And so I think in this age of social media where people are taking pictures of themselves, posting them online, they're doing things that are potentially harmful in their future lives. And in fact, you think of a young girl, 18, 19 years old with skin cancer, it would be rare, I would think, 20, 30 years ago, and we're seeing it now more often.
Wow.
And it's especially the melanomas, which are the most dangerous of the skin cancers. So
that's scary.
Yeah, it's really scary. Yeah, and it's something that we don't really, it's not popularized in media. You still can find tanning booths even in a beautiful place like this where you get UV radiation every day. We think the tanning booths play a huge role in this number of increasing skin cancers.
Really?
And I'm surprised it hasn't been banned already. We look at regulating smoking and all these other health industries, and that's another area I feel like we really need to kind of key in on is these sun tanning booths, which are really doing no benefit to anybody in general. So
I know when I was younger, the girls would always try and mix like a baby oil and iodine.
Yes.
Very popular. I don't know if they still do or not.
They don't do that as much, but I do hear that. I mean, that was something that was really popular before, but now I think it's even more harmful is they're not using the natural UV radiation for sun. They're actually getting the artificial radiation, which is it causes direct damage to the skin cells, even more so than regular sun does.
Wow.
So yeah, it's something that I really, anytime I see a young patient in my office, I try to encourage them to stay away from the tanning booths, to wear sunscreen, wear hats, wear sun protective clothing, the surfer shirts, the rash guards when you go in the water in the lake.
Right.
Really important because that's the age group where you really get the most sun damage before you're age 20, and that affects you when you get to be 40, 50, 60 years old. Most patients that get a lot of sun when they're younger, they look older as they age because the sun has damaged the skin cells, and so if you want to look better at an older age, you're better off avoiding the sun.
Talking to a friend of mine the other day who has a health club, and for the licensing, now they want the tanning beds licensed.
Right.
But the amount that he had to go through to get it there, he just figured enough is enough. I don't need these
Not
things.
worth it. Yeah.
Not worth it, and especially when it comes to the health risk. And he was aware of those. He said, no, we're done.
Yeah. Las Vegas and LA are probably the two biggest areas for these tanning booths, and they're still popping up all over the place. I see them all the time, and I just kind of shake my head because it's a moneymaker for them, but it's really the health risks are huge.
Yeah, absolutely.
And they're not talked about really.
So let your conscience be your guide in that regard. If you don't have to use a tanning bed, don't. And if you want to go out in the sun and get a tan, be smart about it and at least get checked up once every 6 months or so. Every 6 months does not hurt you, and it's well worth every cotton pick and dime. I want to thank you very much. Always good talking with you, Doctor.
Always good talking to you.
See you again? Good.
Definitely.
Yeah, actually, we'll be back in a week. We'll be back with more of the morning show right after this.